greater. That's not really what they're intending to do here. What they're intending to do here is to put more people over into a public assistance plan because that works in the basic philosophy of putting people's lives more dependent on government. And every step of the way, this is the plan. Anybody that reads through? Yes?
I read today, and I'd like you to confirm or deny that there's some sort of medical corps that's going to make intrusive visits of first-time pregnancies and families with small children. Can you confirm or deny that?
No, I can't.
It's on the web via Instapundit or Grudge. I'm not sure which one.
No, I cannot confirm or deny that. I think that you can read. I think you can read through this bill and find enough paragraphs that has enough loose language in it to where you could you could probably
reach that conclusion.
You could probably reach that conclusion and say, yeah, on page 23 forward, there's authorization to do that. But I can't officially. Yes, sir.
Kenny, I'm Dick Brewer. Just wanted to know, assuming the Grim Reaper, we've been hearing a lot of news about the nuclear option in the Senate. And I want to know if this indeed happens. They could, because they have the votes.
Yeah.
They could force it down our throats. What can we do if this happens to turn that ship around? How do we steer that ship and gain our freedoms and independence?
Well, one of the only things in this bill that is probably good news is it doesn't go into effect till 2013. So if you had a significant change in representation, congressional representation, a lot of this bill could be negated, changed, reversed. A lot of the implementation rules could be changed. So it puts a lot of pressure on 2010 and just try to get at least one branch of either the House or the Senate back under control, or at least take 20 seats back over where every single vote, the Speaker, Pelosi, has to have all of her people. She has the luxury right now of allowing on any given vote 30 or 40 people who are in close districts. Those people are telling them exactly what you're telling them. Allow them to vote against her so they can go home and say, you know, we voted against her. When you narrow that margin down, then every single bill, I dare say cap and trade would not have got through had we had 20 more Republicans or 10 more Republicans. Probably this healthcare plan would not have survived the vote. You'd be shocked at the number of votes that are separated by 1 or 2 votes, even now, with an 80 vote. So that's the good news. If we get busy and begin to reverse things, and there are almost 80 seats out there now that 6 years ago were occupied by Republican congressmen that are now occupied by Democrats. We all know why that took place. We all know about the Republican congressmen losing their way, spending, earmarks, the culmination of 10 years of power, Republican Senate, Republican President, and just beginning to spend as if there was no tomorrow. The American people punished the Republican Congress for that. There's not any doubt about it. And they took the power away from them. Let's go back now to our main principles, and let's go back.
What's the part that comes to light in this about immigration is that you force the hospitals to be the immigration department, and that's not right. That's what's hurting our mission in our hospital more. And you got to do something about immigration if that's the issue, and not put in our hospitals the responsibility of being the policeman, because that just takes away from our mission. And Dr. Anderson will tell you that's the biggest distractor we have. And with this bill, with the president saying it will not cover anybody you're gonna create a tremendous rip at the hospital.
Yeah.
And what you're gonna do is our ERs, everything will be an emergency. And if we don't take care of it, we spend $50,000 fine by not taking care of it.
You're absolutely right.
So, I really think somebody needs to take the lead to deal with it. I mean, it's getting all washed down in the health stuff, but the immigration is still the big issue. It's the cause. We're treating the symptom.
At this point, the priorities of the administration are really completely opposite of what we thought they would be. We thought the first bill that would be pushed through would be an amnesty bill that would basically give amnesty. No one will utter that now. So my feeling is this solution is that at some point the public plan that's being proposed will be broadened to where it merges with the public hospitals and merges with Medicare, and where you have, and the illegals will get shifted over to an insurance program that the government pays for, and then the burden will still, but hopefully their purpose is to disperse the illegal population out into private doctors' offices and clinics, and basically disperse them and normalize them. So you've got to deal with the immigration issue first, but if you don't deal with it, if you deal with amnesty, then you're just going to have 15 million more people on the roads. And we can't, there is no amnesty bill that's even been drafted by Pelosi or Obama. So we don't know what's happening with immigration. We thought it'd be the first thing they would do. So,
In our opinion, Kenny,
yeah, absolutely.
amnesty is completely foolish.
Oh,
I'm sure we all agree on that.
I think we do. Yeah, no, I'm not proposing, I'm just telling you what I think the plan is. I think they plan on backing into that. Yes, ma'am.
The horrible thing about this plan here is that, first of all, I happen to be an immigrant, but I came here, we were sponsored, we became citizens, my parents learned English, obviously I learned English. But by allowing this plan to have every illegal immigrant, open up the floodgates, every illegal immigrant will come here, just like Obama's aunt came here, she decided to retire on social, on welfare here. You're going to open up the floodgates and everyone will come here and it will strap us, it will break this country.
It will
And not only that, you have to translators, and my parents had to go for anything in the United States. They took the translators, and the translators were their children who learned the language. We didn't have anything written in another language. Nothing was afforded us in Italian, and I really resent this. And this is funny. Like I said, I am an
I think
immigrant.
it will exasperate. I think it will
It will
increase.
break this
It will
country.
be another reason for someone to come across the border,
Exactly.
do anything to get here.
Yeah, real quick, something doesn't seem to get much press, Representative Marchant, is that in the House Bill 3200 right now, federal employees, state employees, tribal land employees are exempted from having to go into this plan.
Yeah, and that's wrong.
And I know you've co-authored an amendment to change that and make everybody equal.
Absolutely.
What are the chances that that's going to get passed?
If Grassley, if Charles Grassley said, I'm walking out of the room unless this amendment gets on, it could go on. The problem is that he would probably trade his vote for that. So when they begin to pick us off with, well, if we put this amendment or this amendment, it jeopardizes the final passage. Everybody ought to have, every government employee should be in the same group.
Right. And even state employees.
My state employees,
State employees.
a lot of the states self-insure.
Correct.
And they just hire a manager to manage.
Correct.
So, and we got states' rights, so we stay away from trying to manage the state's business. And
why isn't that getting more media? Why aren't representatives like yourself honestly speaking out in the public about that issue? I hear nothing, and I watch a lot
it came
of
to a vote. Henry Waxman was the deciding vote against it, as you recall. That amendment was proposed proposed in the House. It failed by one vote. Henry Waxman is the one